Hi, my name is Kisha May S. Narvasa from Bachelor of Secondary Education major in English, and this is my COVID-19 awareness advocacy. What is COVID-19? Coronavirus disease 2019 or the COVID-19 is defined as an illness caused by a novel coronavirus called Severe Acute Respiratory Syndrome Coronavirus 2, which was first identified amid an outbreak of respiratory illness cases in Wuhan City, Hubei Province, China. It was initially reported to the World Health Organization on December 31, 2019. On January 30, 2020, the World Health Organization declared the COVID-19 outbreak a global health emergency. On March 11, 2020, the World Health Organization declared COVID-19 a global pandemic. It is the first such designation since declaring H1N1 influenza a pandemic in 2009. Illness caused by SARS-CoV-2 was termed COVID-19 by the World Health Organization, the acronym derived from Coronavirus Disease 2019. The name was chosen to avoid stigmatizing the virus or origins in terms of populations, geography, or animals. What are the possible modes of transmission of COVID-19? Transmission of SARS-CoV-2 can occur through direct, indirect, or close contact with infected people through infected secretions such as saliva and respiratory secretions, or the respiratory droplets, which are expelled when an infected person coughs, sneezes, talks, or sings. There are terms generally used to classify COVID-19. These are asymptomatic, mild, moderate, severe, and critical. Asymptomatic COVID-19. Having asymptomatic COVID-19 means that you have no symptoms. If you live in a house with people with a COVID-19 infection and you have no symptoms, you may be an asymptomatic case. And it seems that this occurs more often in the healthiest and the younger age groups, including most children. Mild COVID-19. The virus affects mainly your upper respiratory tract, primarily the large airways. Key COVID-19 symptoms are temperature, a new, continuous cough, and or a loss of your sense of smell or taste. Patients with a mild illness have flu-like symptoms. This may include a dry cough and mild fever, but the fever may not reach 37.8 degrees Celsius, and there may sometimes be little or even no cough. Moderate COVID-19. Patients with moderate COVID-19 may have inflammation moving down into the bronchioles. They are more breathless and tend to have an increased heart rate, particularly if they are moving around. With moderate COVID-19, you may have a more troublesome cough than those with mild symptoms. Severe COVID-19. Severe COVID-19 means that you have pneumonia, which is inflammation caused by infection of the lungs themselves, right down into tiny air sacs or alveoli. And the last one is the critical COVID-19. In severe pneumonia, a condition called ARDS or acute respiratory distress syndrome can develop. The small air sacs in the lungs become so inflamed and wet that they tend to stick out, and surfactant cannot do its job as there is too much inflammatory fluid in the alveoli responding to the virus. You need help with inflating your lungs. This is what a ventilator is for. People with critical COVID-19 are very unwell.